righty. So good morning, everyone. I would like to call the Durham Recovery and Renewal Task Force meeting to order. Happy rainy Friday. I do miss seeing all of you weekly, and I trust that that feeling is mutual. If you recall from our last meeting, Mayor Schul challenged all the task force members to get our flu shots by this meeting. And it was my plan to do a roll call and see who'd actually gotten their flu shots. But because I had to reschedule my doctor's appointment until next week, I won't do the roll call. But I do know that George got his because he raised his hand at our last meeting to proudly say he has gotten his flu shot. So if you hadn't gotten your flu shot, highly encourage you to go ahead and get it, because I will be doing a roll call at our next meeting when I am compliant. So as usual, we do have a full agenda today, so I will go ahead and get us started. So I'm just going to turn it over to Mayor Schul and Chair Jacobs to provide us with some updates.
Thank you, Maticia. Wendy, shall I go ahead? Good morning, everybody. It's great to see you. Now that we don't meet as frequently, I miss your faces, and it's really good to be back with this group. I do first want to report that I did follow George's example and get my flu shot. And now I've heard I'm supposed to put that on social media, so I'm going to restage it by putting a Band-Aid on my arm and get it out there to the world. Yeah, just a few things to report on. One of them I know that a lot of people have been thinking about is Halloween, and we have talked about that earlier at the task force meetings. Right after this meeting today, the mayors of the 6 largest cities in North Carolina are meeting with Mandy Cohen. Mandy had asked us to hold off on making any Halloween rules or pronouncements until she had a chance for her staff to figure out what they thought might be some statewide guidance. I'm not sure exactly how that's going to be. You could imagine that the needs in, say, Cullowhee, North Carolina are different than the needs in Durham vis-a-vis Halloween, but we're anxious to hear what guidance that she has to offer. And then next week, I'll be meeting with some of the neighborhoods that have the largest number of trick-or-treaters, some of the neighborhood association presidents, to talk about what to do. And then shortly thereafter, I'll be working with our staff and talking to Wendy and Rod and others about making some decisions. And that'll have to happen pretty soon. I think people need to know. I want to talk about something else that we discussed yesterday at City Council. This was really came out of some really good work that our staff has done, and Ryan has helped lead, as well as Tony Thompson for the city, which is work about what ought to happen related to water cutoffs and people's inability to pay with their water bill. And as you all know, this has expanded tremendously during this period. It has been a real problem. And we've had a moratorium on the cutoffs, which is great, but people really need some more help to pay their bills. We've had about $150,000 allocated towards that. In the past year, not all of that was used, even though we know that more people needed it than took advantage of it in previous years. And then this year, that amount has been far oversubscribed. So the council is talking about allocating more funds for out of our COVID relief funds for people to support people who are not able to pay their water bill. Interestingly, we're not able to build this relief for people by law into our water rate base, and so we have to provide that out of general funds, out of tax money, and so we're talking about that. And also, a whole lot of work has happened again under Ryan's leadership to change the way we are charging late fees, to actually eliminate late fees, which we would be able to put into our water rate base and spread that around, and do a whole lot of other work that will help people avoid late charges of water cutoffs. And so I'm really proud of that. But we have some budgeting to do that's to help people through this. I do want to mention one other thing, and I know that this will be a discussion later, but I was able to go out last Saturday to the Streetery and have dinner at Mothers and Sons outside. What a fabulous beginning to that. And I want to congratulate Nicole and everybody else who worked on that. And it really was good. It wasn't too many people, but it was a lot of people. And it was just right, I thought. And I know the restaurants, a lot of them had their best days in a long time. So that was fabulous. Unfortunately, because of the destruction that was visited on downtown last night, Nicole, and I know she will tell you this, has had to put a pause on this for this weekend. One of the things about that was so sad, I think, about the destructive activity the other night is that our businesses are just beginning to come back, and to have them affected like this is just it's a very unfortunate, very unfortunate. And I want you all to know, and I think you do know, that we're not going to accept that in Durham, that Chief Davis is prepared to take the steps that are necessary to make sure that we don't see that level of destruction. We haven't had that in Durham until this past weekend. We had a few broken windows previously, but nothing like this until the past few days. Righteous protest, we totally support. And civil disobedience, we totally support. We understand and we get, but not people who are breaking, come to town or living here in town, that come downtown to break windows and then quickly disperse. So that was harmful to us, and I just want to let people know that we're very, very aware of it. There are a lot of other COVID-related things going on, but I know that you'll hear about them from Wendy and from other people today, and just want to again appreciate all the work that all of you all are doing. We're still in very good shape relative to where we were and relative to the state and the nation. And so congratulations to everybody for all this good work. And I'll pass it over to Wendy.
Mayor, could I say one thing on the Streetery?
Sure.
And I'm sorry to interrupt.
No problem.
Jacobs. That was not an easy decision for DDI to make, but I want to be very clear that what went into that decision, after talking to the restaurants and talking to Police Chief Davis, we too recognize that what occurred in downtown on Wednesday night was not a protest. It was an opportunity, or individuals taking an opportunity after a very sad day to come in and destroy property. Our decision to pause, we're trying not to use the word cancel or anything, so that folks know that this is just a pause, that we plan to be back next week. But our decision to pause was one around that, as we try to build up. So we have a couple of businesses now that have to board. They had window damage, and we have others who are considering boarding, and people have to decide what is best for them. But it's also to recognize that there are people who are disappointed in what happened in Louisville, and people who want the opportunity to express that sadness and frustration. And it seemed appropriate at this time to allow for us to figure out ways to adjust should this happen again, this unnecessary violence, but to also recognize what's going on in the country and what's going on here locally. So weighing all of those, plus how very positive last weekend was. We had many, probably all of our restaurants in the downtown area and adjacent to report one of their best weekends since COVID started, to include some of our retail businesses who opted to stay open on Friday and or Saturday night. But weighing all of that, we realized that truly the safety of individuals needed to be the thing that drove us this weekend. So we hope to see you all out next week, and we appreciate all the support that you have shown us. And please know that this is just a pause. We are not going to end this. We will be back out having that wonderful environment again. But I just did want to say those couple of things. But thank you.
Thank you, Nicole. And good morning, everyone. Good to see everybody. I miss seeing everyone. I don't miss getting up early for a meeting every Friday, but I do miss seeing everybody every week. I just want to join my voice with that of Steve and our mayor to really condemn what we saw the other night in Durham. You know, people have worked so hard for many months to make the streetery happen. I was out of town last weekend, or else I would have been there. But I had seen such positive comments on Nextdoor about people who felt very safe, very comfortable going downtown and had a really positive experience. So we absolutely need to remain committed to that. And I think what was so upsetting about the destruction the other night is just that the impact to our community organizations like Self-Help, who does so much for our community, and also just for all of the businesses that were impacted. You know, even a broken window. Now I read that because of the pandemic, it's hard to get glass. So even repairing windows are going to take weeks for many of the businesses. And so it's just a setback. And again, our local businesses are the lifeblood of our community. They've already been struggling. We've already lost many of them to the pandemic. And they employ many people. People are dependent on our small businesses throughout Durham and downtown thriving so that their workers can support themselves and their families. So we cannot forget about what that means. And so we want to encourage all of our businesses and everyone who has been impacted to not give up, that we stand with you, and that we are going to continue to do all we can to support you. And I'm confident, I know Sheriff Burkhead is on here this morning as well. I know that the sheriff is working very closely with Chief Davis as well, and that we will be better prepared for if something like this happens again. Just big picture things. I know we're going to talk more about Halloween. I've got my vaccine appointment scheduled. Thank you, Maticia. And today I know we're going to talk about evictions. I think when I think about what are the looming crises that we really need to be prepared for, one is obviously the flu season. I'm really looking forward to the conversation about evictions. I'm very concerned about the eviction crisis that is really happening now, and us having a really comprehensive approach as a community about how we deal with that, because that is the most fundamental thing. We need people to be in safe and secure housing. When we think about all of our families doing virtual learning and the impact on children, trying to do school, it's really the most fundamental thing. Housing is having safe, secure housing is just fundamental for everything else related to wellness and safety. I think I know this is something that's been on our radar for future conversations, but just about mental health impacts. I'm sure everybody has seen, and Rod is the expert on this, but just the ongoing stress of the pandemic, the sustainability of this. And, you know, again, we're seeing data about, you know, increase in depression, mental health, suicide. And I think it's something that we need to be aware of and talk about here at the task force, and the highest rate being amongst our youth and people in their 20s. And this is something, I'm part of something called the Durham Directors, as other people are here. Rod is a part of that group. But we had a meeting recently, and just talking about what really came out is not just the stress of the people that are being served in our community by all of the agencies, but also internally with staff, the actual, you know, DSS staff, public health staff. So I think that's will be something for us to really start talking about. On the good news front, the state is going to be issuing again PEBT. This is additional food resources for our Durham public school families that already get free and reduced lunch and other types of food assistance. We really want to get the word out about that. That is coming back. Another word of great news is that our DSS has been awarded a HOPE, participation in the HOPE program. This is a state program where we are going to get $2.4 million in rental assistance. This is really fantastic as we talk about the need for rental assistance later on this morning. This is great news, and we'll hear more about that. I think Katie's going to tell us about the Slow COVID NC app that the state has also put out there. I think we should do all we can to get people to download it. I did it. It's very easy. And this is another tool for us and to help all of our public health and contact tracers. We're holding steady on our caseload, which, you know, our spread and our positive cases, which Rod will talk about. You've all probably heard about what we expect coming out on October 2nd with large entertainment venues of 10,000 people will be allowed to have 7% capacity. So we're waiting to hear more about that. You may have heard the news last night. The Durham Public Schools has decided that they will remain virtual for the remainder of this semester, this 9 weeks. But I think we have to stay focused again on how this is impacting people, and the participation in the Hope Learning Centers that the Durham Public Schools is running, as well as the city and county have funded. My understanding is that the participation is still very low, and I think trying to understand what are the reasons for that, why people are not necessarily taking advantage of that. The Eat and See feeding program that the county has helped fund has 200 families enrolled, over 800 people in our community who are getting additional food assistance is great. And again, Durham Public Schools is doing another huge feeding program that we haven't talked a lot about here, but which is getting food out to our students who qualify for free and reduced lunch. So, and one closing comment is just about the elections. I think again, another stressor in people's lives, and that to let everybody know something that we talked about yesterday with our state delegation, and Derek Bowens, our director of the Durham County Board of Elections is that we have gotten back, we've distributed about 50,000 absentee ballots in Durham County. So far we've gotten about 12,000 back. But one of the concerns is that there are a number of these ballots that have not been filled out properly. They may be missing just a signature. And so there's a big effort right now with our Board of Elections staff to get the word out to people that you have the opportunity to what's called cure your ballot. And so right now, many folks from the Board of Elections are trying to reach people. There were over 300, I think the number was 376 yesterday, that needed to be corrected. For instance, they have a missing signature. And the Board of Elections staff are calling, emailing, sending letters to let residents know that they need to do that. And there are many ways that they can do that through the Board of Elections. So we really want to get this word out to people to respond when they're contacted. And I will also just say that early voting in person is a very good option for people in Durham. We will have, 14 locations, 17 days, staff have put very safe procedures in place. If you feel safe going to the grocery store, it will be absolutely similar to that. So I just want to encourage folks also to consider early voting as well. And I will stop there. Thank you, everyone.
All right, thank you, Mayor Schul, Nicole, and Chair Jacob for those updates. I'll just give a quick update on our budget proposal process. And if you recall from our last meeting, we had 4 budget proposals that were brought forth to the task force. And just as a reminder, we had one for language access services, one for rental assistance, one for pulse oximetry, and one for PPE warehouse. We had a subcommittee that got together to evaluate those proposals, and I just want to give many thanks to Pilar, Jody, Anthony, Ryan, Katie, Ibukun. Hopefully I didn't miss anyone because we spent quite a bit of time going through the proposals. And Ryan shared an email that basically identified the one proposal that we were moving forward with, and that was the language access services. And that proposal extends an existing contract that we have to allow interpretation and translation services for our efforts. The other 3, we determined that we needed some more work done on those proposals before we move those forward. So we're continuing to work on those so that we can move them forward. For this meeting, we were planning to present any additional proposals that folks have worked on. I'm not aware of any new proposals that are being brought forth today. So again, we will continue to work on the 3 existing proposals that we know of to get those ready so that we can continue to move this forward. So now I want to welcome Sheriff Clarence Burkhead to our task force meeting. We've invited Sheriff Burkhead to share with the task force how COVID-19 has impacted our detention center operations, and also share with us, what's needed to continue to mitigate the virus within the detention center. So I will turn it over to Sheriff Burkhead. Thanks for joining us.
Good morning. Thank you for the invitation. Good morning to everyone. Well, I am sure you all are very, very familiar with COVID. Today is day 200 of the state of emergency in North Carolina has been dealing with the COVID-19 virus and crisis. When we first heard of the virus, reached out to my colleagues and instructed my staff to reach out to King County in Seattle to learn what mitigation strategies they were beginning to implement there. This was in February, and then shortly after that, here in March, we began to implement some of those strategies and tweak them to prepare for what we thought was the inevitable. So we've been doing that very early on. Number of things that we've done, we immediately put the detention center on lockdown to limit the possible transmission. We started making requests for additional PPE to our vendors and going through our own stockpile, making sure that we had the resources on hand that we needed. And then we started meeting with our leaders across the state of North Carolina, including Governor Cooper's staff, Chief Justice Beasley's, her and her staff, our AOC staff in Raleigh, just to make sure we had a solid plan moving forward, in addition to our mayor and Chair Jacobs, City Council, Board of County Commissioners, again, gathering all the information. I am happy to report that we've been relatively successful keeping COVID at bay. I used to say keeping it out of the detention center, but unfortunately we have now had in August our first positive case. Up until then, we had not had a single inmate infection in the detention center. We did have that first case in August, a gentleman who had been incarcerated for over 2 years. So it still baffles our mind, working with Mr. Jenkins on how it was transmitted, but we pretty much know it was communal, someone coming in and out, be it staff or employee, et cetera. But we immediately put that individual in isolation and started the testing, and he in fact did come back positive. Since then, we've had 21, I think it's 21 inmates test positive, 9 staff members have tested positive through the testing that we conducted in April. And as of today, we have 0 positive cases in the detention center. So we're happy to report that. We still continue our mitigation strategies. Our mitigation strategies include screening of everyone who comes into the facility, both at the courthouse and detention center. I'll talk a little more about the courthouse in just a moment. But for all new arrestees, they're screened before they enter the facility by our medical staff, our medical provider, WellPath. They go through the temperature checks. They are asked the COVID screening questions about contact and potential exposure. And then they're placed in a 14-day quarantine area and monitored on the regular before they go into general population, if they are not released prior to that. Our population today is approximately 288. So with our low average daily population, we've been able to be creative in creating areas of isolation and areas of quarantine so that we don't expose potential infected or other inmates who have the virus. We don't have to put them in general population. We also house all of our detainees in single cells, and we're able to practice as much social distancing as possible inside the facility, again, with this average daily population being low at this point. Although most recently we've seen a slight uptick. We've been hovering around 247, 248, and as I mentioned today, we're at almost 290. Unfortunately, we do anticipate that number to continue to rise. The one thing that COVID has not stopped is crime. And you all know that we're seeing an uptick in crime, be it COVID related. This is where we are right now, unfortunately, as things play out on the national scene as well as the local scene. But we're continuing to fight this virus as much as possible. Just a few more points on what we're doing. All of our employees are screened as well, as I mentioned. All of our employees have been tested at least once now, and I want to spend just a couple of minutes. I know we're slightly behind schedule, but I want to spend a couple of minutes talking about next steps. We've worked very close with Rod Jenkins and his staff since day one. I told Rodney early on that he came to Durham at the right time or at the worst time. But nonetheless, we are fortunate to have his expertise and the partnership that he and I have developed over these short few months. We've developed a testing strategy. You're going to hear more about that from Rodney. But moving forward, what I would like this group to know is that we need to now begin mass testing like never before. There are several groups here in Durham that were screaming for mass testing in March and April and May and June, and even screaming for decarceration, which is not under my authority to do. But this decision was made with public health and all of our health partners across the state, did not see the need to implement mass testing at that time. Again, we had not experienced an outbreak. We had no cases in the facility. Unfortunately, we did have a tragic loss of one of my senior detention officers early on, Senior Detention Officer Petaway, but we were able to, through contact tracing, determine that he contracted the virus from outside the facility and never brought it into the facility. So there was no need for mass testing until we had an outbreak. Well, we've crossed that threshold. So now it is critically important that we secure the funding to do mass testing moving forward. And my team and staff have put together a plan to present to the Board of County Commissioners on next week. We've already had discussions about how we're going to implement this, and they're discussing the funding issues. But I think we are in this space now for the duration. And what that means is once we do mass testing, hopefully in October, and we have a 0 case rate, that's the goal. And then to monitor the virus, we will do periodic testing moving forward, a sampling of 20 or so employees as well as detainees, to make sure that if we discover someone who is positive, we can move quickly to isolate and start further mitigation strategies to again contain and hopefully abate the virus from spreading further within the facility. We're doing the same thing at the courthouse. And talk just a moment about courthouse. As you all know, court itself was closed for a period of time as a result of Chief Justice Beasley's order. The courthouse never closed because we're open for public business and constitutionally are mandated to remain open. So we put together another strategy to protect the men and women who work at the courthouse, and certainly all of our visitors. We see sometimes no less than 800 visitors to or more per day. And so I instituted immediately the face covering to be worn when you come into the facility, which was certainly in line with the governor's order as well as the Durham County order. We have hand sanitizer and signage throughout the facility. Anyone coming into the courthouse, be it employee or a visitor, have their temperature checked at the front door. They are screened, and if they do not have a face covering, we provide them with one, or they are more than happy to go back, allow them to go back to the car and retrieve their face mask. The courthouse has gone through a deep cleaning as contracted by County General Services about a month ago. Those chemicals that were used to do the deep cleaning are approved by CDC, and hopefully that solution will keep the virus off of hard surfaces for up to 90 days. But again, like I say, we are stressing hand sanitizer. We have cleaning supplies in the respective offices throughout the courthouse, and we have masks available should someone enter the building and not have them. And these measures will be ongoing. So I'm going to stop there, and I'm happy to take any questions that you may have. But again, thank you for this opportunity. As I said, moving forward, our goal is just to do mass testing and continue to practice our mitigation strategies to hold this virus at bay. Thank you.
Thank you, Sheriff Burkhead. I appreciate those updates. Are there any questions for the sheriff?
Yes, I have a couple of questions. This is Herbert Davis, pastor of Nehemiah Church. You mentioned, if I wrote it down right, that there have been 21 inmates and 9 staff that have tested positive. How many tests, do you have a total count of tests that you actually did run?
We have tested, Pastor Davis, if I'm not mistaken, I'm looking at my numbers here, in our initial round of testing, and 294 tests have been conducted. That was in our first round, and Mr. Jenkins can confirm my numbers, but I have a listing here of 294. And then we sent most of our employees outside the facility because at the time we did not have the means to do mass testing for our employees. So the majority of employees at the Durham County Sheriff's Office have gotten tested through their primary care. I don't have those numbers, or through the drive-through clinics that are available across Durham County and Wake County. A lot of our employees also live out of the county. So I don't have those numbers. But my last count, Mr. Jenkins, if I'm incorrect, please chime in. It's about 294 initially.
It's correct, Sheriff. We were successful in testing all inmates. And as he mentioned, Reverend Davis, we couldn't account for those employees who went through their primary care physicians. But I'd definitely like to give a shout out to Duke, who assisted us in our first round of testing with the inmates, to include on-site here in the public health parking lot and also at the Holton site. We are most appreciative, but our overall goal was to make sure that everyone was tested and we were successful.
Okay, thank you. My other question, I know you mentioned that you're already working on your proposal to present to the county board. Are you able to share how much you'll need to ask for, or is that something you cannot share here? Or feel, yeah, that's my question.
Well, we're still working on the numbers and the strategies. I can tell you it's affordable when you're talking about really doing all we can do to beat back this virus. So the number is going to be somewhere between 30,000 to 100,000, and that would include inmates, detainees, which will be tested with public health and our healthcare provider, and then we're working with risk management to secure a contract with an outside vendor to provide testing for our employees. So that number is still in negotiation. So it's a manageable number. I was, in the grand scheme of things, I certainly don't want to talk light about our financial resources, because we do recognize that they are limited. But again, as I said, this is something that is critically important moving forward. Mr. Jenkins and his staff have stepped up to the plate, so we're able to see some cost savings by doing as much of this testing in-house as possible. So we're going to present to the board a number that I think will be financially palatable, and hopefully they'll approve it.
Sheriff, I'd also be remiss if I had not acknowledged the help of General Manager Jody Miller in assisting us in these endeavors. I'd also like to add, Reverend Davis, that the county has been gracious enough to at least look at a multi-year approach due to the uncertainty of COVID-19. So we're not sure exactly how 2021 is going to play out. So they are looking at potentially funding beyond 2021.
Yeah.
Okay, thank you both.
Sheriff Burkhead, you mentioned things that are being done at the courthouse, like making sure that masks are available, hand sanitizer. As I think about the task force, and one of the reasons we invited you here was we're trying to figure out, is there anything that we can do to help? So as you think about like face masks, hand sanitizer, is there anything that you need help with in terms of making sure that you have the appropriate supply?
Well, we've been very fortunate. We received a grant early on that allowed us to sort of increase our stockpile here at the Durham County Sheriff's Office. Duke University has been very generous with us and supplied us with masks a couple of months ago. So that too helped. And like Mr. Jenkins mentioned, we're not sure what next year is going to look like. So I recently contacted our colleagues at the Administrative Office of Courts and were able to secure additional masks and gloves. As we continue to have court and we begin to resume jury trials, we know that the activity in the courthouse is going to increase. So right now we are in stockpile mode. We're gathering as much PPE as we possibly can to include hand sanitizer, face coverings, and gloves. So we have a network of private partners and governmental partners across the state and that have allowed us to really get to a point where I think we're okay right now. 9 months from now, I can't say. So if this group were to be able to aid us in that, it would be securing additional PPEs and then certainly getting the word out to the general public to please continue to practice the 3 W's, and anytime you come to the courthouse, be prepared to go through the screening process. I think public information and getting the word out is critical. We've been doing this now for 200 days, as I mentioned, so most people know, but every once in a while someone will show up, but we are prepared to aid them so that they can come into the facility and conduct their business. So any assistance that you can do with getting additional supplies and PPEs and getting the word out at this moment is what I would request.
Thank you for that.
Hi, I have a question. This is Cece or Chanel Croxton of the National Domestic Workers Alliance. I'm not sure if I missed it or if this is going to be presented in the proposal for the county commissioners. But is there a frequency of testing for employees, or is there a plan to create a mandate for a certain amount of testing, whether that's weekly or monthly? Is there a mandate for that?
Yes, we'll follow the same strategy that we're going to follow with detainees. So after we do the next round of testing everyone in early October, then we'll move to testing a sampling every 2 weeks, and we'll continue that for as long as possible. But yeah, that would include employees as well.
And is that sampling random?
Yes.
Any other questions?
I have a question. Sheriff, surely the virus in and of itself doesn't cause people to commit crimes. And I was just wondering if you could shed some light on the increasing crime rate and why that might be happening in this area, and what might be done to reduce the crime rate during this time.
That's a very good question. I'll answer it this way. The national climate is certainly not doing us any favors as it relates to the civil unrest that we're seeing. And that's going to continue beyond Election Day, unfortunately. So my colleagues in the National Sheriff's Association and the North Carolina Sheriff's Association are having discussions about that right now. So we know that's coming. And we're preparing to assist our chiefs of police in our jurisdictions and really put together a strategy to protect our right to vote and make sure that we are prepared for some of the disturbing intel that we're receiving as we approach Election Day. So that's sort of the national picture. At the local level, there are a number of things that are contributing to the increase in crime. Certainly, you know, when we were in lockdown, we saw a slight uptick in domestic situations, what's to be expected. We also have now seen an increase in home invasions, armed robberies. Certainly the shootings that are occurring in Durham are at an unprecedented level. There's no real answer as to what's causing this particular uptick. I'm sure there's some people on this call that are more informed about the mental state that COVID has impacted us. And so I'm sure that's playing into it. And then we're looking at the economics of COVID. A lot of people are out of work. People are desperate. And so there are a number of things that are contributing. So our job is to really try to strategize and come at this thing a different way. We cannot arrest our way out of this. We've had over 200 shootings in Durham. Over 189 of those individuals have been hit. So Chief Davis and I work close together, as was mentioned earlier, and we have to find a way to address this gun violence. And we may have to employ the assistance of our federal partners, because this is something that in my 30+ years here in Durham, we've not witnessed this. So we also have to secure guns and put out public service announcements about gun safety and responsible gun ownership. I've been pushing that since I've been in office, because a large number of the weapons that end up on the street are stolen from vehicles or homes of persons who own them legally. So we've seen a large uptick in home invasions. So I know that's not a clear answer on what's causing it. I think there are a number of contributing factors, but some of the same issues we had prior to COVID still exist. We're looking at poverty rates that are extremely high. We're looking at a system that has oppressed people, and people are starting to push back on that, and doing so in a number of ways. And I think all of that is contributing to the crime that we're seeing and experiencing.
Thank you very much.
Well, Sheriff Burkhead, I just want to say thank you so much for joining us this morning and providing the update. This has been a great conversation. And we will certainly get back with you to let you know what we can do to enhance your stockpile. We certainly want to help you any way that we can. But again, many thanks for joining us this morning.
Thank you all very much.
All righty, so I'm going to keep us moving, and I'm going to change the agenda just a little bit if Rod and Katie and Ibukun don't care. Instead of going to our public health update, because we have another person that's been invited to the committee and want to be respectful of his time, I'm going to move us to the update on evictions, and then we'll go back to the update on public health. But want to welcome Peter Gilbert to our meeting this morning. Peter oversees legal aids, eviction diversion, and DSS staff, and he's going to provide us the current state of evictions here in Durham and challenges that we currently face. So welcome, Peter, and thanks so much for joining us this morning.
Thank you so much. Just to clarify, I don't oversee the DSS staff, and we've got a couple of our partners here from DSS, Director Ben Rose and Deputy Director Janine Gordon, who I think will have some more to share about the DSS programs for emergency rental assistance after I've given an overview of where we are with evictions generally. So thank you so much for taking time to hear about and address this important topic this morning. I'm going to attempt to share my screen. So did that work?
You're good, Peter.
Yes.
Excellent. Okay. So this slide is linked in the agenda that Ryan distributed. So the presentation, I'm not going to go through and read every word in detail. I want to be mindful of your time and provide plenty of time for questions. Again, I'm Peter Gilbert, and I work for Legal Aid of North Carolina, where I help supervise the eviction diversion program here in Durham. So generally, the legal outlook with evictions, as Sheriff Burkhead referenced, and as many of you know, there have been a variety earlier in the year of protections that were halting or limiting the eviction process as a legal process. Most of those are now over. So the governor's moratorium is over. The various actions that the Chief Justice had taken to delay or limit court appearances, as well as the CARES Act. There are some lingering effects that are still relevant to some of the pending cases. I'm not going to go into the specific details, just to say that these don't apply to the majority of cases, and they don't operate as a moratorium to stop the cases. What we have now is the CDC moratorium, as it's called. I would say that the CDC's order is not really a moratorium. It does not prevent landlords from filing eviction cases. The clerk's office, under the guidance from the administrative office of the courts, are still accepting the filings. The courts are hearing the eviction cases, and the sheriff is prosecuting and executing the writs with the writs of possession. So I think there's a lot of confusion in the public, but evictions are on, basically, is the legal summary. People are being evicted. Both, the process is beginning and going all the way through to the end. And the CDC moratorium really operates as a defense, not really a moratorium. So this is something that tenants can do to help protect themselves from eviction, but the burden is entirely on the tenant. So some of the previous, whether it was the CARES Act or the governor's moratorium, really operated to prevent the landlord from acting. And in this case, the CDC moratorium does prevent the landlord from proceeding with an eviction, but only if the tenant sort of proactively asserts their rights, right? So the first step in the process is the tenant has to sign a declaration and give a copy of that to their landlord. And so what this declaration says essentially is that they've lost their income or had health expenses due to COVID, that if evicted, they would become homeless or they'd have to double up with somebody, that they're making efforts to make payments if they can afford to, and they've applied for government assistance, and basically that they either received a stimulus check or that they make less than $100,000 in a year. So they sign this, and there are steep penalties for, it's under threat of perjury, and there are very steep penalties in the CDC's order for fraudulently filling out one of these declarations. So what I'd like to ask all of you is, we really need help, and I know that our partners with the county and with DSS have helped do this, that getting this information out broadly in the community for tenants to know their rights, that this is the moratorium as it exists. It doesn't function automatically. It requires tenants to be proactive. It requires them to make efforts to pay. It requires them to apply for assistance. And most importantly, it requires them to complete this declaration and to give it to their landlord. If they don't do that, then it doesn't matter if all of these conditions are true, they can still be evicted. Tenants then have to go to court, right? Because filing this declaration doesn't automatically stop the landlord from filing the case. So they've got to show up in court with this declaration and assert a defense. This is why most tenants honestly need legal assistance and legal advice to understand whether or not this declaration applies to them, as well as to know the penalties for not filling it out correctly. I will say that the law is sort of unsettled. This is new, and we're aware that landlords will be challenging the CDC's authority to even issue this declaration. And so in Durham, the courts are generally not dismissing these cases, even if the tenant shows up in court with the declaration. What the practice in small claims court has been to continue these cases, often just to continue them for 2 weeks. So the moratorium says that you can't evict someone until the end of the year, until January of 2021. But what's happening right now is the courts are simply continuing these cases out about 2 weeks. Now, if the landlord agrees, they're being continued longer. But if the landlord doesn't agree to the continuance, they're only being continued out a couple of weeks. Just an overview.
Hey, Peter?
Yes.
There's an actual question in the chat box about the slide that you just covered. CC, do you want to pose your question?
Hey, Peter, I was just asking if all the conditions have to be true to make the declaration, or if it's just one or more of the conditions. Can y'all hear me?
Yes, it looks like Peter maybe frozen. I don't know if we've lost him. We'll give him a minute or two to see if he rejoins us or his connection reconnects. Hopefully he's attempting to reconnect because his screen has gone black.
The power of technology.
Looks like he's coming back. You're on mute, Peter.
My apologies. This is the way things go during COVID, I guess. So I heard there was a question and then my internet cut out. I apologize for that.
No problem. I was asking if the conditions that you laid out to make the declaration, if all of those things have to be true, or just one of those conditions.
No, all of the conditions have to be true under the declaration. So, well, you don't have to have both increased medical expenses and a loss of income. You just have to have one financial hardship. So some of them are alternative. You don't have to have gotten a stimulus check and make less than $100,000 a year or $99,000 a year. Just it's an either or. But for the most part, all of the conditions have to be true. Does that answer your question?
Yes, thank you.
All right, I'm going to attempt to go back to the presentation. Did that work?
Yes.
Good. So that was the CDC moratorium, and I'm happy to take more questions about that afterwards. I want to talk just a little bit about an update of where we are with filings. We saw very few filings from April through June, and you all linked in the agenda along with this presentation is a sort of a fact sheet that John Colleen and DataWorks put together for us about eviction filings. One of the things, just his summary, is that evictions have begun to creep back up in July and August and under pre-pandemic conditions in Durham. We saw, I think in the last fiscal year for which we have complete data from the courts, there was about 9,500 evictions filed in Durham. And it fluctuates between about 500 and 1,000 a month. In July and August, we saw around 200 eviction cases filed each month. I think that the sort of a precursor to the filing oftentimes is application for legal assistance or application for financial assistance from DSS. We try to resolve as many cases as we can pre-filing. And so if we can treat the applications for our assistance as a bellwether, and I think we can, the wave is really crashing, right? Some of us have been talking about how we were going to see a tidal wave of evictions when the various legal protections were lifted, and we're starting to see that. So we averaged 35 or 40 applications, new cases that we opened for the first 7 months of the year. We opened 184 new legal cases in August and 185 so far in September as of yesterday afternoon. And just so you know, we have funding through the city for our eviction diversion program, and our capacity under that funding is cases a month. So right now we're opening files at 2.5 or 3 times the rate of what we can handle. We are determined to provide as much legal assistance to as many people as we can, but realistically, our capacity is limited. So especially with the CDC moratorium and the way it operates, we think that legal advice is essential for most tenants to understand their rights and how to exercise their rights. So that is a big issue for us, our capacity.
It seems like Peter is frozen again, so I think he's continuing to have issues.
I wonder if we want to invite Ben Rose to share any comments from DSS on evictions while we're waiting for Peter to come back on.
Yeah, that would be great.
Ben, are you there?
I am. Can you hear me?
Yes, sir.
All right. So good morning, everyone. Peter was doing such a great job there. I was enthralled with his presentation myself. So I'm Ben Rose. I'm the Director of Social Services, and I have my partner in crime, Janine Gordon, on the line as well, too, who's the Assistant Director of Aging and Adult Services and has really become our housing guru in a lot of ways in DSS. Housing is not typically a service that DSS gets involved with, but in Durham, we have really started to become, this has become a primary part of the spectrum of services that we deliver. I think Peter was doing a good job covering the nuts and bolts, so I'll just give you a little feel real quickly for how we've partnered in the funding that we're drawing down to do this. We knew this was on the horizon as Peter was starting to talk about, and we always felt like, you know, we had challenges in Durham with evictions. We were always at a higher rate than a lot of our neighbors, and that was a slippery slope. And then when the pandemic hit, I think we felt like we were probably on the top of Mount Everest, waiting to really fall. So we really started to do some things early on to try to put resources in place. Because our role in the eviction diversion side is really to help with the financial assistance part. One of the first things we did was we have a county eviction diversion program. So before we got involved with anything from the feds, we actually went to the county commissioners back in, I believe it was May, when there was some reallocation of funds. And we got about $100,000 for June. We literally had 30 days to spend $100,000 for rental assistance and to help people. Our goal was to try to keep people from getting to eviction. That's one of, as Peter was about to talk about that's one of the big things that we try to do. And we had absolutely no problem spending that money in 30 days. So we knew that this was on the horizon. Janine has done a phenomenal job in developing partnerships with the city. We work very closely with Reginald and Karen with the community development part of the city. And we have gotten, I'm sorry, I've got a dog trying to get into the way here. We've gotten a grant of CARES funding through HUD to help us with the initial surge of the eviction diversion. So we've got a little over $1 million right now that we have finalized, and we have an executed contract with the city. And these are the funds that we're using now to try to help with these cases that Peter was talking about. Janine has, in addition to that, has been working with the HOPE program, which is through the Office of Recovery and Resiliency. And through this program, Janine has actually secured and already executed a contract for over $2 million in financial assistance to help us with eviction diversions. These funds are really interesting because they have some nuances about them that our other funds don't normally have. They can help with rent and utilities. They have no cap to the benefit. They basically can help with up to 6 months of rent based on where the need is. It is eligibility based. It's based on median income. I think it's 80% of median income is for this program. And the process actually starts with the dialing of 211, which is that service that's provided through the state. And they actually access those funds through 211, and then we get the back end referral to complete the application and issue the benefit. So getting a little over $2 million from this, and this will go to the Board of Commissioners in October, is something that is really, I believe, going to help us and help hopefully keep some people stable. Now, again, we know the need is going to outweigh the demand. I think Peter was actually starting to illustrate that on one of the slides, and if he gets back, he may be able to cover that. You know, we're helping with about 70 people a month right now, and they're seeing 180 applications. We're seeing that on our end as well too. Janine actually reported at one of our meetings that I think our phone system has crashed about 3 times during the pandemic over the last couple of months as these needs have become more and more available. So we too have capacity issues. We understand it can be frustrating for our citizens at times because we have just a limited number of staff. We've pulled staff from other areas to help us with this program. We have staff, obviously in the COVID world, we're working differently. We have more staff remote. And we're doing things by phone. We're not seeing people in person like in the old days when they just walked into our office and we came in and we saw them. So we're having to make appointments and do things by the phone. But we have those capacity issues and we're trying to do the best we can to address those. The one positive thing that has come through this new grant that we're getting is there are some administrative funds available, and we plan to use those administrative funds. We didn't with the first round because we wanted those funds to get to the clients, but we have a 15% administrative allocation with the new grant. So we're going to use that to probably hire most likely temporary type workers, but it will be people that can help us try to move applications more quickly. So these partnerships and Durham, that is what Durham is all about. This is what you guys are doing right here. It's all about these partnerships that we've been able to develop to try to leverage these resources. I mentioned the county eviction diversion program earlier. We've already spent $102,000 in that program as well so far this year. So we only have about $180,000 in that pot. So these federal dollars are really a big resource for us. And we are working on more. Janine is understanding there may be more funds that can flow. So we're keeping our ear to the ground. We're working with our partners to leverage as much as we can leverage and as much as we can administer so that we can serve our citizens and try to keep some people stable during this time. Real quickly, since I don't see Peter back yet. I know Commissioner Jacobs wanted me to hit on a couple of other highlights, and I can do that really quickly for you to give you a feel for some of the things we're doing in DSS to help our citizens. We've been really focused on our primary programs in social services, the food and nutrition program, Medicaid, crisis intervention, energy assistance. Obviously, we do child welfare and adult protective services. But we've been very successful in partnering with the state and the feds to get waivers that have enhanced these programs during the pandemic, which has been a great resource for our citizens. And I'm not sure if everyone is aware of that. Just a couple of quick examples for you to give you a feel for what we've been able to do. There's the pandemic EBT program, which has provided an FNS supplement, an EBT card that people can take to the grocery store to purchase food for those that have children in the free and reduced lunch program in schools. Since school has been remote, they've lost that program. So we were able to work with the feds to get a PEBT program. There was an issuance back in the spring for when school was remote then. We were thinking and told that we cannot get that for the fall. But lo and behold, within the last 2 weeks, we were able to get waivers from the feds to do one more. So there's another issuance of pandemic EBT going out. Another positive that has really happened with our food and nutrition program is all of our recipients are receiving the maximum allotment of food and nutrition benefits. So let's say, just to give you a good example, as a senior, you probably hear a lot about seniors that they're right at that income threshold and they get $15 in food and nutrition benefits a month. Well, if they're let's just say a single senior and they get $15, now they're getting the maximum allotment, which could be $110. Every food stamp household is getting the maximum allotment available to them. And they've been getting that since, I believe, April, and it's continuing as long as the state of emergency is in place in North Carolina. So that is another positive thing that we've been able to do. In Janine's area, they have the low-income energy assistance program, and the state has issued benefits under that program to help people with energy cost right now. And that's in addition to the regular program that will be rolling out December 1st. We've been able to get a $100 stipend for our foster parents who have foster kids. We have unfortunately had to deal with foster kids that have tested positive. Commissioner Jacobs knows just the other night we were dealing with that. And we've been able to at least get some financial support to our foster families there. So that's just a few examples. There's others. A lot of the waivers that we got, some were administrative to help us within DSS to deal with the work. We saw over 8,000 food and nutrition applications come in about a 4-month period. So especially in the peak when we were March, April, and May, we just were bombarded with food and nutrition applications. So those kind of waivers helped us from a capacity standpoint. It helped us process that work and keep work moving. But we're still in a difficult situation. We still are having a lot of work come in, and we've even lost some staff due to medical conditions and so forth. So we're doing the best we can. We know we have frustrated citizens out there at times, and we try to address those issues as they come through. But we've been very, very fortunate, I believe, to get a lot of additional services to our clients and our citizens to help them during these times. And the eviction diversion program is obviously going to be a big one as we go forward. I've talked a lot, so I'll give Janine a chance to maybe add anything she'd like regarding her services.
Good morning. I would just like to reiterate that with all these additional programs, this makes a huge impact, obviously, on the budget of our citizens who are able to stay at home and continue to have that stable housing. We have a variety of programs that I administer through Aging and Adult Services. One of them happens to be the HOPWA program. And there is no doubt, the evidence is very clear that having safe and stable housing impacts healthcare. Obviously, that's a social determinant of health or a social driver of health. So that's why this is really passionate work for our division, to make sure that we keep as many people at home, as many families at home as possible in safe and stable housing. Having all of this money available for all of our residents is obviously a real blessing for us, and we're super excited about that. But we know that the need is greater than the supply of dollars right now. So we're going to keep moving forward and trying to get as many grants as we possibly can, because we do know that the end is not in sight at this point, and we want to make sure that we have the funds available when they are needed. As I said, we have a variety of programs in Aging and Adult Services, but as it relates to eviction diversion program, we have utility assistance, we have durable medical assistance, we assist with pharmaceuticals, we assist with a variety of other programs that help with rent before it gets to the point of eviction. So we're really trying to cut that off earlier upstream so that we don't get to the point of having to file for eviction, as well as a variety of other helpful things for families to maintain their household, whether it would be for food or bus passes and things like that. So lots going on.
And the crisis intervention program, which is one of our big programs that helps with utilities, we've been able through the state to get some waivers there to make it a little easier to qualify during the pandemic. They don't require a disconnect notice like they did in the past. Before, it required a disconnect notice. Now we just had to have a past due bill. So again, trying to keep people out of that hole during this pandemic and keep people afloat as best we can with the funds that we do have, which again are limited. We're not going to be able to help everyone. We acknowledge that, but we do the best we can with the outreach. The pandemic has obviously presented a lot of challenges. People are coming to our agency in a different way now. They're not coming into a lobby and seeing a worker. They're actually coming and pulling an application and dropping it off, and we're calling them, or they're doing it through ePass, which is an electronic version. But it's a new way of doing business, so we realize there's challenges with that too. But I feel like our agency has really adapted well to provide a safe work environment and still get these services out. And I think the expenditures are showing that we definitely have a need, and we're able to get these services to our folks. I see Peter is back too. So.
Yes. So Ben, Janine, thanks for those updates, and thanks for sharing with us those things that you and your team are doing beyond evictions, because I've been, as you articulated very well. Not able to help everybody, but I think just the mere fact that you guys are trying to help as many as you can is very important. So I really appreciate that.
Thank you. Thank you.
So I'll turn it back over to Peter to highlight a couple more things before we transition or open it up for questions.
Thank you, and I apologize for my technical difficulties. I want to reiterate what Ben and Janine said. It's been a pleasure, this partnership working with them. It's certainly, I've had the opportunity of talking to my colleagues in other cities at Legal Aid who are working on similar rent relief programs. And in fact, in counties where we don't have a partner like DSS, Legal Aid itself is administering emergency rental relief in a number of more rural counties that don't have the privilege of working with experts like we do at DSS. And so we've had regular meetings with the city's community development department and folks at DSS and Legal Aid. And we're actually well ahead of the curve in terms of working out the kinks and getting this program working. So grateful for that partnership. Two other points I'd like to make briefly. One is just about the number of evictions we're actually seeing in court. I appreciated Sheriff Burkhead's remarks and everything they're doing to keep the courthouse safe. I won't go over this whole slide. You can look at my presentation. But just to let you know that evictions take place in the smallest courtroom in the courthouse, in small claims court, and are always the most crowded dockets. And we have continued to see this despite the pandemic. So yesterday morning, there were 21 cases set for one 30-minute calendar in a single courtroom, which is, I'm estimating 500 or 800 square feet. I don't think there's any way to do that safely. We have seen since August, we have seen small claims eviction dockets with 140 or more cases set for one courtroom for one half-an-hour docket in a courtroom, as I said, less than 1,000 square feet. So this continues to be a grave concern. Chief Justice Beasley's orders on the safe operation of the courthouse are still in effect, and it doesn't have to be that way. Mecklenburg County is continuing most evictions indefinitely. They're not scheduling these large dockets that we're continuing to see in Durham. The other point that I wanted to make was, I'm glad for the great news about the additional emergency rental assistance, but just to put it in scale, in context, the estimates nationally are between 10% and a third of households are not able to pay their rent due to the pandemic. In Durham, a majority of tenant households were already cost burdened. More than 50% of households were already cost burdened before the pandemic. So if there's about 60,000 tenant households in Durham County, we're talking about between 6,000, 10%, and 20,000 of households who can't pay their rent. And with an average rent in Durham of $1,000 a month, that's $6 to $20 million in unpaid rent each month. So the generous program from the city to the county of $1 million, we estimate will help between 300 and 400 households. The new $2 million that was just announced will probably help twice as many households. But what we're talking about is a scale much bigger than that, right? We're talking about, by the lowest estimate, 6,000 households who will struggle to pay their rent because of the pandemic. And I'm happy to take any questions.
Thank you for that. This has been really valuable discussion and information, and certainly I appreciate all that you are doing. This is, you're doing phenomenal work. I do have one question, and then there may be others who have questions. When we think about rental assistance, and I apologize if you said this and I just didn't hear it, is this assistance available for those who are undocumented as well, or does that need to be a separate program?
This assistance,
As far as the financial assistance is concerned, we do not check citizenship in order to be eligible for the money.
Okay, thank you.
and from the legal assistance end, unfortunately, Legal Aid of North Carolina is prohibited by federal law from representing undocumented immigrants. We can represent many other classes of immigrants, but our partnership with the Duke Civil Justice Clinic and Professors Holton and McCoy allow us to meet that need. So no one's being turned away, and they're eligible for legal assistance as well through our partnership with the Duke Civil Justice Clinic.
Perfect, thank you. Are there any other questions?
I have a question, and thank you, Peter, Janine, and Ben, for being here. I just want to say uphold all three of them as being incredible champions in our community. If anyone knows Peter, they know that he is just unrelenting in his focus on this issue. And I will say thanks to him several years ago presenting at the Durham Directors Group, we ended up, I ended up bringing the problem of evictions that he raised to our joint city-county meeting. And because of the partnership between the city and the county, we formed the eviction diversion program. And our staff are working together across the city and the county and with legal aid. And that's just a testament to everyone who has made that possible, that we had that in place for this crisis. I also want to hold up our DSS staff. They are the true heroes, I mean, in our community now, who have been working, I mean, tirelessly. As Ben acknowledged, we had a crisis the other night with children. And we had staff who came out helping COVID positive children who literally slept in our Durham County DSS building, and people who stayed up all night with them. So those are the kind of things that happen behind the scenes that people, you know, don't know about. And I just want to recognize all of those heroes that we have. Peter, your comments about and I'm sorry I missed whatever the sheriff said about what was happening in the courthouse. But Peter, I'm concerned about what you raised, the issues about the crowded hallways, people that you noted in your slides that there isn't a staff person calling out cases, that people are missing, tenants are missing their cases, and that also you noted that there weren't masks available, that people are being turned away, tenants are being turned away if they don't have a face covering. You also noted that there is discretion and that in Mecklenburg County, these cases aren't being heard. So I just wanted to hear from you. What are some suggestions that you have of how we can address this, and who do we need to pull together to have a conversation about it?
The discretion for the safe operation of the courthouse rests with the local chief judges. From what I understand, in district court, there are more limited dockets. So we have cases in small claims and in district court, and those have been staggered, and those are bigger rooms to start with. My real concern is with small claims court, which is always some of the largest dockets. And they don't generally have a deputy or a court security officer in the courtroom or even in the hallway. It's just the magistrate. There's no other court staff in that room. So the magistrate has to both sort of run court and cannot also then, be in the hallway or anywhere else. And so what we've seen, and these dockets are public, so you should contact the clerk and just ask for the small claims dockets. You don't have to take my word for it. But there are regularly dozens of cases set for 1/2 hour court appearance by the clerk. And even if they're limiting the number of people that can be in the courtroom at the same time, what that means is that everybody else is lined up in the hallway with, there's tape on the floor, but there's no other staff or anyone else sort of enforcing social distancing in the hallway, unless there's legal aid attorneys, and we're there almost every day now, trying to do our best. But I'm definitely getting concerns from my staff just about their safety and their comfort in being in those conditions. And I don't think that it is common for people to show up at the courthouse without a mask. I think that we've done a good job as a community in getting out public information about the importance of wearing a mask and bringing a mask to court. But if you don't have a mask, you're not let in the courthouse. And there doesn't appear to be a system to alert the court that someone came to their court date but couldn't come in due to not having a mask, or conceivably their temperature being raised, or the other necessary safety precautions that Sheriff Burkhead is enforcing to make sure that we keep the courthouse safe. But if someone shows up for their court date and they're not there, they're going to lose. And so that is a concern about what happens if somebody shows up and they can't get into court. There needs to be some method to communicate that they did try to show up and weren't allowed in due to either not having a mask or for whatever reason. The dockets themselves, I think that if the Chief Justice's order is clear that if the cases can't be done safely, then they can be continued. And I have a hard time imagining how it's safe to have dozens of people on a calendar for that short a period of time.
This is Lois. May I ask a question, please, to Ben? Thank you all for this just tremendous amount of information. I think somebody mentioned that typically folks can access information via 211 was one way. I'm assuming some people who may already have social workers. My question is, I'm particularly concerned for folks who may be on the cusp of borderline for qualifying or being eligible for some of these, for some of these waivers. Where are they then referred? Or again, just talk about, I can imagine there's not a typical person who calls, but if it's someone who is adept at knowing how to access social services, they may come to social services. Others may who have heard about it through some other way through 211. What are other ways folks know about it or made aware of these resources?
Sure, and Janine may be able to add to what I can tell you here, but definitely one function that we do when we do make assessments for our services, if we're not able to get them qualified, is we do share with them other community resources through our system. We have a network of care in Durham that I don't know that a lot of people even realize about our network of care and all the resources that are listed there. It's a really great system. And now we're developing the 360 as well too. So we're focused on, that's a little more focused on the social determinants of health and what we do through Medicaid, but we still can use that to get people connected to other agencies where if they don't qualify for the government side of things, we can definitely connect them to nonprofits and other provider agencies. In terms of accessing, I think in terms of how they access, that's a bigger issue. We're actually partnering right now on about at least 2, maybe 3 projects with Duke and Sanford School of Policy. Commissioner Jacobs set us up with one with Ryan about access and how we deal with access, because we understand access has probably always been a challenge because the system is so confusing. It's overwhelming, especially in a resource-rich area such as Durham. And then you throw on top of that a pandemic now where it feels like we're working so differently. How are people just getting connected in general? That is going to be one of the big thrusts that we really try to look at and address quickly. But we are used to helping the folks that do get to us. If they do not qualify for our services, we get them connected with other services and agencies. And Janine, you wanted to add anything for that? Because Janine's area does that a lot.
Yeah, absolutely. We obviously don't just assess for one program. We are going to assess for every program that they may be eligible for. And all of our programs come with different eligibility. So just because you don't qualify for one doesn't necessarily mean you wouldn't qualify for others. So we definitely want people to take away the idea that if you come in for crisis services or rental assistance, obviously you don't come in, but if you're seeking those services, just because you might not get this one doesn't mean you might not get one of the other 8, 9, or 10 that may be available. If that doesn't work, NC Care 360 is obviously an option for us to refer back into the system and see who may be available to assist as well. And we obviously have a resource list as well as the network of care.
Great. Thank you so much. This is has been really robust dialogue, and I appreciate all of the questions and all of the wonderful information that you've shared. I do want to allow Sheriff Burkhead just to respond briefly, and then I'm going to move us on to our next agenda item because we have about 30 minutes left in our meeting.
Yeah, thank you. Yeah, I just wanted to respond to Peter's concerns, and he's correct. That's a small courtroom. One of the issues that we're having, and I'm continuing to have my staff check on the scheduling of these eviction proceedings. That docket comes out of the clerk's office, and they normally schedule those proceedings for one day, and notices go out to everyone. So most of the time, anyone who has received the notice shows up on that day. We're looking at trying to move those proceedings to multiple days instead of just one day, or move them to a larger courtroom, which with the docket on the criminal side being somewhat smaller, we may be able to do that, but that ultimately is going to be up to the clerk of court, Mr. Archie Smith, and I'll speak with he and his staff about that. And then the social distancing, we try to make sure people stay 6 feet apart, and Peter's correct. We have the tape and the stickers on the floor to encourage that. But that's usually one day where it's really sort of chaotic when all those eviction notices go out. But we'll take a look at it. And thank you, Peter, for raising that.
Great. Thank you. And again, thank you all so much for what you're doing and for sharing with us today. I hate to cut the conversation short because I know this is a really important conversation, but we do have a number of other items on the agenda that we need to get to. So thank you.
Thank you.
If I can turn this over now to Rod to give the public health update for us, that would be great.
Only after you give the hospital numbers.
Absolutely. So I have I apologize. I do not have the 7-day average for us because there's been a change in how we look at it within my hospital. And so when I went to pull it today, I didn't have the same document to pull from. So, but I can tell you that today we have, last week we had 30 across all 3 hospitals. We have 35 earlier this week. Today, specifically, we have 35 across Duke Regional and Duke University Hospital. So we're seeing our numbers fluctuate a little bit, but still maintaining pretty close to that number, and that sort of 30, 35 across the 2 hospitals. And we continue to be over 90% capacity between Duke University Hospital and Duke Regional Hospital. And today we have 9 COVID patients in our ICUs, again, between both hospitals.
Thank you so much, Katie. Good morning to everyone, and I promise to be brief. We currently stand at 290 active cases, 7,263 inactive or discharged cases. We did pick up a number of deaths since the last time we met. We now stand at 94. We picked up about 8, and those were from various long-term care facilities and individuals who have been in the hospital for quite some time. So as always, our thoughts and prayers are to the families of the Durham residents who have passed away due to COVID. That brings our total to 7,651 total. 14,320 total cases have been made, contacts have been made through CCNC and the Department of Public Health. We remain relatively stable, as Katie has said. Our 7-day moving average is at 30. It fluctuates from 28 to 30. So that really indicates a level of stability. So far in the month of September, as of Monday, there were 626 total cases so far. Not much change in race, ethnicity, and work. Latinx COVID positives continue to go down. They are remaining relatively stable at anywhere from 40, 39 to 40% of all of our cases, but we continue to prime the pump and work really, really hard with our partners with that. Black African American remains proportionally represented at 35.7%, and whites remain underrepresented at 21.5%. Again, no real changes in terms of the individuals as far as the employment sector. We still have unemployed individuals, mainly Hispanics, females who are infected, construction workers, mainly Hispanic or Latinx males who are affected. But again, we're beginning to see a little bit more activity along the lines of our nursing care facilities, with 38.8% of all infections being Black or African American, and they are mainly females. So we're working with our long-term care facility strike team, and along with Dr. Cam Wolf with Duke, to make sure that we do a deeper dive into that particular section. As far as our percentage of positive labs that are reported electronically, relatively low, continues to stay low. For the week of 9/3 to 9/19, 3.6% of our labs were positive. For the prior week, it was 3.3%. If we check with Duke's model, they have Durham's infection have grown to 3.2%, whereas North Carolina overall have infections growing at 4.5%. Overall, as a region, ladies and gentlemen, we're continuing to do relatively well per state epidemiologist, Dr. Zach Moore. He's indicated that the northeastern region of the state has seen some surge of activity. However, central and southeastern North Carolina continues to do extremely well. Another area that I'll hit on, and then I'll pass it on to Dr. Akinboyo, is schools. Of course, with the decision to remain in remote learning, was taken into consideration and under advisement by myself and Dr. Akinboyo and a number of different people with Dr. Mbenga. However, that rate for those individuals under the age of 18 remains at 15.7%. The last time we met, they were at like 20%. So we continue to see COVID infections with those individuals 18 years and younger continue to go down. And that's attributed to the hard work that Durham County has been doing. We're getting the word out about masks and 3Ws and doing everything that we can. We are encouraged with the app, Slow COVID NC. It is a non-invasive, it's not Big Brother tracking. And I know Katie's gonna have a few words about it. But the most important thing I'll say as your health director is that it is a tool that states like Virginia and South Carolina and many others are using to mitigate the spread of COVID. And it only works if more and more people are using it. So it's available on the Google Play Store and the Apple App Store. And I do believe it's free of charge. And it's definitely a good thing to help us to mitigate the spread and further keep Durham safe. At this time, I'll pass it over to Dr. Akinboyo for additional comments.
Thank you. Thank you for all what your office is doing as well. No major comments. We did expect to see slight increases in our daily case count, and I think you alluded to that a little bit, but it's encouraging that we didn't see a massive jump in cases 2 or 3 weeks after the holiday. But if people have questions, happy to weigh in. We're seeing data that's encouraging for kids. So in whatever area of influence you have, there may be ways we can educate kids safely. We just need to ensure that conversation continues as we go into the flu season. And to join the campaign, please get your flu shot. Thank you.
Great. Thank you both so much. Are there any questions? If not, we'll move on to our discussion around economic recovery. And I think Geoff and Anthony are going to give us an update on that work.
Thank you, everybody. And as you've heard today, crime and eviction are critical problems that are facing our community. And I'd just like to point out that the work we do about getting people back employed does a tremendous service, and working in dependable jobs is a tremendous service to addressing those important needs of the community. we were originally given 30 minutes, and that was going to be tough even with the Q&A. And if I could just open up to Dr. Nelson, Pilar, other folks, maybe the best way to do this today is, instead of going through the full slideshow, we just talk about the KPIs that we're looking at, or I'm opening up to, because we're trying to play this out live, I'm opening up to the team to figure out what it is you'd like to be able to present, because we're not going to be able to get to all the recommendations in the next 18 minutes. Folks, thoughts?
Yeah, I think so. And I just said from my part, I've been trying to bring the Latinx perspective to the group, but I think we need to include, and we've discussed these other groups or other people like the Hispanic Chamber of Commerce. And also bring, again, the equity lens to this group.
Thank you, Pilar. Your voice has been so critical in help guiding all of the work that we do. So I guess what I'm hearing from the group is that we're going to go ahead and try to at least get through as much as we possibly can. Is that a yes?
I'll leave it.
I'm fine. I'm fine with that. But what I also don't want to have happen is that we get right up to 10 o'clock and we don't have time to really talk about what we are presenting. We do have two guest speakers that we have invited. I've not reached out to see if they could join us later, but I think what they have to offer might encourage some discussion among this group. So we're now at 9:40. And there are other things on the agenda, so I throw that out there. And again, I've not talked to Latasha and LaShawn, but we've spent a lot of time on this, and I would hate for us to present, it ends, and then in 2-3 weeks we come back and people have forgotten.
Yeah, so
that's my biggest concern.
Why don't we try to, if, and I know you've put so much time into this, so I hate to defer it till the 9th, but I want to give it enough time on the agenda to have, to really have the discussion and have the questions. Could we defer until the 9th and put this first on the agenda?
I think we can, but Nicole, do you think it would be appropriate and effective if our guests presented and we defer the presentation?
And LaShawn, you're texting me. Why don't you speak up? Go ahead and speak up. I really want them to have the time to have the conversation. So Latasha and LaShawn, I will defer to you, but I want you all to be able to present without rushing and to really engage with this community. And again, my fear is that you will present, and there's a lot that they want to present that will take a good 15 minutes. And I know at 9:55, I'm gonna be honest, maybe you all won't, but I'm gonna be honest, 9:55, I'm switching to the next thing I gotta do at 10:15. So I'm really not focused. I'm shutting down from this meeting. So I don't want to shortchange the work that they have done. So I'm going to ask to LaShawn and Latasha, what do you all think about that?
I agree with you, Nicole. Good morning, everyone. This is Latasha, and we can, I guess, I don't want to rush it just because there's so much good information, and our business owners and our businesses really do need to hear and from what we're trying to share with you and be able to make some decisions. So I guess we'll look at our calendar for I think it's October 9th.
Yes, I think October 9th is the next meeting from 8 to 10. And again, we can put you on, wherever you would like to be on the agenda. I would recommend that we put you earlier in the agenda or first on the agenda immediately after the mayor and chair's update, so that that gives plenty of time. And I apologize that we're a little bit off timing today.
So Katie, can I make another suggestion? And this will take some coordination because I know there's a lot of work that's been put into this. Could we schedule a separate session? Because I think we're going to spend about 30 minutes on this. So could we schedule another maybe 45 minutes before our next meeting to really dive in on this topic? Would the task force be open to that? Because I know folks have put a lot of work in this, and I do apologize for us getting behind on our agenda today. And I feel like there's energy to talk about it sooner than later. So
I will say that the task force has met, our subcommittee has met multiple times just in the past week trying to finalize this. And I agree with the team, the committee wholeheartedly, that to shortchange this and to rush through it, especially as Nicole pointed out so acutely, these meetings run long. So I do think either pulling it out and having a specific economic recovery conversation is the way to go, because 30 minutes, I'll be honest, and what we had presented in our dry runs was tight. And that allowed for 5 minutes of Q&A. And I'd like to think, at least given by the nature of the robust discussions that I've seen here today, that it's going to go a little bit longer than that. So I would say that we would need at least 45. And if there's a call to have an additional discussion on that outside of the regular task force meeting, I think, I'm looking around at the faces, I think we'd be open to that.
I like that idea. I like the idea of scheduling an hour sometime. As you know, when we, as soon as we can, to have the separate discussion. I feel some urgency around hearing these things, and I worry that October 9th is a while away, and we've gotten such good preparation and guest speakers and everything. It would be great to have it a little sooner.
So
Right,
we'll start
we will
working
try
on
to
that
get
now.
something for next week, because October 9th is only 2 weeks away. So if we're going to do something between now and then, we'll need to see if we can get some flexibility in terms of schedules, which I know is going to be a challenge for all of us who are.
Is there any chance this time next Friday works for people? If we did an 8 to 9 or 9 to 10, I'm just going to ask while people are on. It's been a typical time we have met. I don't know if people already filled in their Friday mornings. We could meet next Friday morning.
I could do that.
Could anyone say if they could not do that? I mean, instead of everyone saying yes, if that is an obstacle, I can circulate that, but yes, I'd love to hear from our guests. So thank you, Latasha. That sounds like you're available.
And I'm available. This is LaShawn.
Okay.
Thanks, LaShawn.
Unfortunately, I won't be available because we have mandatory staff training from 9 to about 1. But, again, I would be able to chime in periodically.
Would 8 to 9 work for you, Rod?
I can make it work, Madam Chair.
For me, it works better 8 to 9 because I also have a meeting 9 to 12.
8 to 9 works better for me.
8 to 9.
Well, I do appreciate, on behalf of the Equitable Economic Recovery Committee, I do appreciate this task force acknowledging the critical nature of us reporting out on a full scope of some of the initiatives and the economic recovery strategies that we're looking at and giving it good time. So I appreciate the consideration here, and thanks to the team for being so flexible and being able to regroup next week, and maybe we can further polish the apple in advance of that.
Thank you. Thanks for your flexibility. Really appreciate it. And again, apologize that we are running behind.
Thank you, Latasha and LaShawn. The task force really does appreciate your ability and your willingness to be flexible on this. But I do think what you all have to present and the conversations that we've had are very important. So I appreciate your willingness to come back and sit with us again in a week.
All right. We'll see you next Friday at 8 o'clock.
Thank you so much.
Thanks,
Y'all
Latasha.
have a
Thanks,
great
LaShawn.
day and a wonderful weekend.
Thanks. Appreciate the flexibility.
All right. So we have about 12 minutes left, and we have updates from our roundtables. I think we wanted, we've heard a little bit about the outdoor dining. Is there anything else, Nicole or Susan, that you wanted to add on that?
Hold up, I'm coming. Here we go. I do want to share that sorry, I was getting a feedback. Last weekend was very beneficial, very profitable for many of our businesses. Friday night, many reported that they had a 30 to 45-minute wait for their seating, their outdoor seating. What we're seeing is that people are comfortable coming into downtown. Many folks had masks on. I mean, there were a handful that didn't, but most of the people who did come into the space had a mask. They were wearing the mask. Many of the, all of the wait staff and all of the restaurants were trying their best to keep 6 feet. We had some issues in some places, and I've reached out to those particular businesses, and they are adjusting to ensure that folks who are waiting for food will maintain the 6 feet, or waiting to be seated will maintain 6 feet. Again, the city was very helpful. We did a kind of a debrief the following week so that we can work on a few little obstacles around traffic and traffic control. But overall, I think it was a very successful weekend. And we're looking forward to bringing it back out the weekend of October 2nd and 3rd. But something that was very beneficial for our businesses, and they were very appreciative. And then a number of retail businesses who kind of watched it on Friday and then opened up and saw a bit of traffic as well. So it was a good weekend, very positive weekend.
Terrific.
It's very good, and I would second that. I've got my video turned off. I'm having a little bit of internet instability, but to add, the Durham Delivers program has been able to, thanks to a couple of donations, has been able to hire a contractor to help expand that program. We've got 20 communities and more than 20 restaurants actively participating, and we have waiting lists for both. And Durham Delivers was providing lunch options this past week, all week, for 40 plus mural artists who were working on their art at the U Hills project on 15501. I would encourage this group to follow 2 new social media channels on Instagram and Facebook. If you'll just type in Durham Delivers, you'll see ongoing updates about the program and some great mouth-watering pictures of food.
Wonderful.
Also, I'd be remiss, I should also mention, and I'll get this information out to you all via flyers. I'm on the Durham Workforce Development Board, and we are hosting or partnering with some regional folks and hosting a virtual job fair on October the 8th for both employers and job seekers. And so we can get that information to you so you can share out with your networks, make sure that we cast as wide a net as possible for that.
Excellent. All right. Let's see if Phil, do you have an update at all from the vulnerable populations meeting? Unfortunately, I missed the last session.
Yes, I do. First, I want to announce that for the 2 weeks that we've been doing the flu shots, that we've issued more than 3,000 flu shots in 2 weeks. That is as many flu shots in 2 weeks as we've issued in terms of testing for COVID-19 over several months. But that's good news. From the roundtable meeting, we had a guest presenter, Dr. Tiffany Kovas, and she works on the LGBTQ plus patient-centered medical home initiative. She talked about the challenges facing that special population and the lack of literature and research available. But as you would suspect, that some of the challenges are around access to information for that group, translation issues, lack of transportation, issues with cultural competence, those kinds of issues, the typical issues that we see in other populations that are that we are representing. Beyond that, we talked a little about, I saw Drew was on the call. So Drew, do you have anything to add around facilities for?
Good morning, everybody. Drew Cummings, Chief of Staff for County Government. We are getting very close to expanding the number of rooms that the county is contracting for at the Carolina Duke Inn from 40 up to 64. We continue to use 4 duplex units that we have rented for COVID positive individuals. Service provision for those individuals is kind of being done on an ad hoc basis, mostly by the agencies that are referring the particular individuals to those duplexes. So that's about what we have at the moment. We have put an RFP for a broader COVID positive hotel on hold a little bit until we get these other things squared away, and also until we have some experience getting approval for the MOA with the state for these agreements, which allows us to be reimbursed for the costs. The cost, for example, of renting an entire hotel for COVID positive individuals would be considerable, and we want to make sure that we are able to cross our T's and dot our I's and have the state reimburse us for that before we dive in. So lots of details, but we're moving in the right direction.
So Phil, how are you guys in terms of your supply of the high dose flu shots? I know there have been some conversation among some of the elderly folks that I know that they were unable to get the high dose flu shots. There was a shortage.
We only carry the regular flu shot. We don't carry the high dose. I myself, I'm in that demographic. I usually go to to Walgreens for my shots. So not that there's a shortage, we just don't carry. With regard to the homeless population, we had an update saying that currently they're getting back to pre-COVID numbers in terms of seeking services. And around behavioral health, there was some information in terms of the impact of the whole pandemic on behavioral health issues. And I know that's the topic that we intend to address in one of our coming meetings. So that's a quick wrap up of what we've done in vulnerable populations.
Great, thank you so much. Susan, do we have anything from communications? I know we've got just a couple of minutes left, but certainly want to hear from you and the team and the great work that you're doing.
Yes, the communications work is ongoing. We just entered phase 2 this week. If you'll recall, we had a 1A, 1B, phase 2 and phase, a lot to do with what kinds of messaging we're putting out, and what is going out now is continuing to encourage businesses to complete the checklist, and also encouraging people to get out and do so safely. So you should see it, if you are watching media, you should see it across a variety of different kinds of media.
Excellent. That's terrific. All right, are there any other updates to bring before the task force this morning?
Just to remind everybody that Hispanic Heritage Month is September 15th through October 15th. So,
excellent. Thank you for that reminder.
And I'd like to bring something up, but have more conversation perhaps at our next meeting. I'd like to encourage, as we go about encouraging people to get out and do so safely, that this committee consider modeling that behavior for others. Now that we are able to meet in groups up to 25, this group actually could meet in person following safety protocols. And I know that there'll be a variety of opinions about that, but I will say that the Convention Center has offered to sponsor this for us. Their production company has offered to support it for us, which means that we recognize not everyone is going to be comfortable meeting in person. But as a community and as a group responsible for meetings and conventions in Durham, we need to be thinking about how small meetings can start to come back and do so safely. So we have been giving a lot of thought to how to do this in a way that protects everyone and is a model, and could even help us, because we can promote how it's been done and demonstrate that there are people using some forward thinking on how to meet safely. So I'll bring this back at the meeting on the 9th, if that's okay.
That would be terrific. We'll add time so that we can have questions and discussion at the October 9th meeting.
Right. And we'll be prepared to speak to how we would carry this off in a safe way.
Perfect. Thank you so much. All right. Well, thank you all. Maticia, anything else that you wanted to add?
I don't have anything else, Katie.
All right. Thank you all so much. Apologize that we ran long today, but we will make up for it next week and the week after. So thank you. Have a great weekend.
Have a
Have a great weekend, everyone.